That was a bad idea. Hi, I'm Nate, a doctor specializing in obstetrics. If you're pregnant, you might be wondering, what's the deal with alcohol? If you haven't done so, please subscribe to this channel and give this video a like. We know that heavy alcohol consumption and binge drinking is categorically bad. There is a strong association between heavy drinking and fetal alcohol syndrome. This syndrome has three main characteristics. Infants and children with FAS have low birth weight and their growth remains stunted for life. They have distinct facial features including small eyes which are close together, drooping eyelids, skin folds on the upper eyelids, underdeveloped top ears, a flat nose bridge, a flattened groove between the lip and nose, a thin upper lip, cleft lip or palate, and a small head. They will also have a wide range of behavioral and mental problems, including hyperactivity, difficulties controlling impulses and keeping attention, memory problems, poor judgment, delay in speech and language, and low IQ. So, we know that heavy drinking when pregnant is bad, but what about light drinking, or even the occasional glass of wine? A study, published in 2017, looked at the prevalence of alcohol consumption during pregnancy in Europe. Of the near 8,000 women who responded, 16% reported to consume alcohol in the pregnancy, with 28.5% of women in the UK reporting to have consumed alcohol during pregnancy, and over half of them having at least 1 unit per month. Most countries in North America and Western Europe have national policies advising abstinence from alcohol during pregnancy. Guidance from the UK's Chief Medical Officers, released in 2016, states that if you are pregnant or think you could become pregnant, the safest approach is not to drink alcohol at all. Therefore, your midwives and obstetricians will advise avoiding alcohol throughout your pregnancy. Firstly, there is an association between alcohol consumption and fetal alcohol spectrum disorder. As it is a spectrum, some children with FASD will have mild features while others may have severe characteristics, and these issues remain lifelong. It is thought to affect 1 in 13 children born to mothers who drink during the pregnancy, and it seems that the risk is greater with more alcohol being consumed. FASD can cause problems with movement, balance, hearing, and vision, as well as developmental delays such as speech, concentration, and social skills, as well as behavioral problems. Some children may also have problems with their heart, bones, or kidneys. Reviews from studies have shown that pregnant mothers who drink more than 1 or 2 alcohol units per day are at a higher risk of miscarriage in the first trimester, carrying small babies, preterm birth, and low birth weight. There will be a link on how to measure alcohol units in the description below. If you consume less than 1 or 2 units per day before realizing you're pregnant, it is unlikely this will lead to any long-lasting damage. We advise that if you are thinking of becoming pregnant, that you limit or exclude alcohol entirely. Please talk to your doctor or midwife if you are concerned. As you can see, the health burden of caring for children with FASD and FAS can be great, as these issues are permanent, and the data that we currently have is limited in knowing what is a safe alcohol limit for pregnant people. Indeed, the Chief Medical Officers state that their guidance takes a precautionary slant. Therefore, its one-size-fits-all approach is designed to be extreme, yet straightforward. There will be people who can metabolize alcohol much faster than others.
Not me.
And so it is possible that no alcohol will pass through the placenta and into baby circulation if they were to have the occasional drink. But we just don't have the evidence to support this, and so we cannot advocate any drinking during pregnancy. Nevertheless, we respect that mothers can make their own life choices. There will be mothers, however, who are struggling with alcohol use. Know that speaking to your midwife or other healthcare providers is safe. We will never judge. Our goal is to keep you and your baby safe. We may ask additional questions, such as how often and how much alcohol is consumed, whether recreational drugs are involved, whether you feel safe at home, or if there's a history of domestic violence. As heavy alcohol use can damage the liver, we may perform additional tests and investigations. I've included additional links in the description below for anonymous support and advice. Give this video a like if you found this helpful. Share, subscribe, and I'll see you again soon. Oh.